Well, welcome everybody. My name is Caroline Corrigan. I'm Director for Health Education East of England. We're one of those new organisations that clearly has got too many E's in our title, because when you try and shorten it, it says H-E-E-O-E. So it's taken me about a year to get my mouth around it. This is Health Education East of England. But wanted to welcome you here this morning on behalf of Health Education East of England and to this fantastic day focused on health coaching. Health Education East of England, well, our role, put simply, in the system is to focus on workforce development. It's to think about the workforce, what we need, plan for the future, and make sure we're delivering the right workforce, the right skills, with the right values for what the system needs today. So our portfolio is quite wide. We cover mainly training and education. But days like today are really precious to me. The health coaching programme, the work of the leadership team is part of our organisation, so it's an absolute pleasure to be here today. In part because it's always fabulous coming out and catching up with colleagues and meeting new friends and meeting new organisations as well. But fundamentally, we, Health Education East of England, absolutely believe in this and support the health coaching programme. We fund it, we support it, and we believe in it. We think it makes a difference. And when Karen Bloomfield first told me about it, my description, my reaction to it was, well, this is a little nugget, isn't it? There's something absolutely right here, isn't there? So I'm here today because, as I say, fund it, support it, but actually really believe in this and starting to see real results for clinicians and for patients. And that's at the heart of our work. So, as I say, welcome from Health Education East of England. The purpose of today, well, share learning, meet new colleagues. In sharing learning, though, we want to hope to prick your curiosity if this is new to you. If this isn't new to you, then help you take more action. So sharing learning for a purpose. And it's a great programme. Let alone the quality of the speakers today, the time that you'll have to meet and learn with other colleagues, and the time around this fantastic venue. My goodness, as I drove up here, this was another new one for me. What a fantastic place. So as I say, welcome from Health Education East of England. There's been some wonderful materials produced. You've got on your tables there the agenda for today, but also some materials that have been given to you that guide you through the event today as well. I'm just going to start briefly. There's a little clip of this in some of those materials about the story to date. As I said, when I first spoke to Karen about this, for me there was a real sense of growing ambition around this. People connecting with the health coaching programme and a sense of momentum and almost an energy of its own. So some lovely facts and figures here about the reach of the programme to date. 780 clinicians so far attending the coaching programme itself. Over 43 organisations now formally participating. And importantly, the work that Penny, Andrew and colleagues have been doing as well, not only to maintain that momentum, but also to pay attention to the evaluation, the evidence around this programme and the difference it's making. So that's a brief sort of story to date of, as I describe it, the nugget, this little thing that seems to be making quite a difference. The aims of today, again, set out in your materials, but it felt, and I've briefly captured my version of the aims today in terms of sharing learning and looking to spread this innovation. But around that sharing, looking at how clinicians and patients are transforming the consultation and what impact is it making on their service. Really important stories around that. To obviously hear the latest thinking and also to share lessons learned. As I say, fabulous programme, lots of different ways you can connect into those aims today, your choice where you spend that time. We're keen that we keep spreading the learning, the message, the story. So if you're on Twitter, please tweet away during today, share your experiences. It's quite easy to do it. And again, the materials in your pack will have given you the hashtags and everything else. I've done a couple of tweets and I know a few other people in the room have done so today as well. Please do that. Now, that's quite a busy slide that describes the programme for today, and it's on that stand up on your tables as well. A couple of things I did want to point out, though. Apart from the fabulous range of speakers, we've got opportunities for question and answer, hence the table and chairs set up there. So there's a Q&A after some fabulous speakers this morning. But just wanted to also draw your attention to 11 o'clock. We will observe a 2-minute silence. And between us and Angela, who's going to be speaking in and around that time, you might see some frantic handshakes and say 5 minutes, 2 minutes, because we, as we make sure that that happens. And I suppose that the connector there for me as well was Karen shared some material about this fantastic venue and pointed out that Linford Hall, in this fabulous history and all sorts of different people that have owned it, now owned by the Forestry Commission. But in that checkered past, all sorts of merchant bankers and doll's eyes and all sorts of things that connect this venue. But after World War II, it was also a convalescent hospital. So it feels an NHS, a health connection straight away. So as I say, 11 o'clock we'll stop and observe that silence. Lots of time to not only listen to speakers, interact with people, and those workshops as well. You decide where you want to spend your time as well. I did want to just briefly touch on, oh no, the one thing I did forget, back on the venue, apart from what an interesting history and what a place, there's no fire alarms planned. I'll do the housekeeping in bits. No fire alarms planned, lots of fire exits. I'll do that aeroplane bit, to your left, to your right, over there. Basically follow the green signs, and if the alarm does go off, we just need to convene. There's a big birch tree out front there, but there'll be lots of people to help and guide, but it's the usual thing about following the signs. So we're not expecting anything. If you do hear it, look for the exits. I just wanted to mention some of the stands. I had an opportunity to speak with Pete this morning. Where's Pete? Pete, the Pain Toolkit. What a fabulous toolkit. Absolutely amazing. And I was talking to Pete about what a great resource, and how do we get more of this in the east of England. There's some really fantastic, again, other nuggets around the place in terms of further information, connecting materials. And I just wanted to explain as well, Fede and the team here. This is, we're trying something new here, capturing today. As you can see, real-time cartoon drawing. I'm probably doing it a complete disservice, but I saw this done the other day in one of our other activities, and I'm a visual person. I loved it. It's a great representation of our conversations during the day, and we'll use these materials after today to share with you as well. But if you're wondering what they're doing, they're capturing the conversation today and just bringing that into a different medium. Easily said. I think I'm fascinated how they do this. So do visit the stands. Pete and the Pain Toolkit, let alone more products and more information around leadership products, as well as the Performance Coach, obviously our partner in the health coaching program. So I've probably, we're slightly over already, so I need to either talk faster or just cut it at that point. I've got great pleasure in introducing our first speaker. Dr. Stephen Dunn, just come on over, Stephen, is ready. I won't go through his biography. You've got that in your packs, but wow, what a great system leader. Day 9 in his new job as Chief Executive. Old pair of hands already. And hand over to you first of all in terms of your topic, Stephen. Thank you.